villages, in rural areas that are not being used. So that should be used primarily, on top of that. So all these things were discussed, and as far as vaccination drive is concerned, Prime Minister Narendra Modi clearly highlighted this fact that states should be in complete coordination with the vaccination manufacturers, so that ramping up of the vaccination or the vaccines primarily can be done, and a vaccination drive can be increased. So these are some of the big takeaways as far as this meeting is concerned. Two important subsets: one is the vaccination drive, how can vaccination drive be increased, and second, of course, related to COVID related matter, and how can testing be increased in rural areas primarily.
Yes, two important components that you flagged out as discussed by Honorable Prime Minister: scaling up of testing and augmentation of COVID care infrastructure, especially at the rural level, and to ensure that there is absolutely no dearth of oxygen supply at rural level. Well, also, Arun, a bit on how Prime Minister has also talked about scientists and subject experts, how they continue to guide the future policy matters related to COVID. And Prime Minister reportedly has also talked about the roadmap for future vaccine availability. That is something which came up for the discussion, the roadmap for future vaccine availability in the country.
Well, absolutely. We know this fact, Sakal, that there are various states that are coming up with the global tenders to procure the vaccines. On the other side, domestically also, we know this fact that be it Dr. Reddy's and Sputnik primarily, or Covaxin, there are various other private players that are coming forward as far as manufacturing of this Covaxin is concerned. So we know this fact that on one side, government is ensuring that how can the vaccines primarily, the manufacturing of the vaccines can be increased exponentially in our country, because we know this fact that the size of the country whereby people needs to be vaccinated is more than 90 crore, 100 crore people which needs to be vaccinated. And we also know this fact that now clinical trials will be held as far as, vaccination drive below the age of 18 is concerned. So yes, we need a lot of, vaccines, and in that context, this ramping up of the vaccines, vaccine production is very much important. And officials also briefed Prime Minister Modi about the vaccination process and the state-wise coverage of 45 plus population. So we know this fact that this was the first strata. I mean, after the healthcare worker and frontline workers, 45 plus was a strata that was opened up for the vaccination drive. So officials in this high-level meeting also briefed Prime Minister Modi that what is the current status as far as all the states are concerned, as far as 45 plus age group is concerned, and what is the way forward below the 45 years of age. So and how can states be in constant touch with the vaccine manufacturer so that vaccine manufacturing can be increased. So yes, on the vaccine point of aspect, these important topics were also discussed.
That very important point, Arun, let's elaborate on it. Healthcare resources to be scaled up and augmented in rural India. And to add to that, the focus on door-to-door testing and surveillance, that's very, very important. Door-to-door testing.
Absolutely. Sakal, what happened in the meeting, in this high-level meeting, when Prime Minister Narendra Modi was chairing this meeting, he took serious note of some reports that are coming in that there are various ventilators that are lying unutilized in the storage in some states. And Prime Minister Narendra Modi clearly directed that an immediate audit of this installation and operation of ventilators, should be provided to the central government as of now. And central government primarily should carry out the audit that has to, with the states, which are the healthcare resources, ventilators that are lying unused, because there are various reports coming in that the ventilators are there with the states, but they are unused as of now. So how can they be mobilized? An audit has to be done. So that was them. That's number one. Number two is that we know this fact that in rural India, in villages primarily, testing and surveillance is an important aspect, and creating, primarily the containment zone. That is the need of the hour. So in that context, Prime Minister Narendra Modi clearly highlighted this point that the ASHA worker, Anganwadi worker, they should be empowered more and more testing and surveillance should be done in villages, because what is the ground situation, Sakal, is that in village, people are still thinking that this is normal viral. This is simple fever. This will go away in 3 to 4 days. But what actually is happening till 5 or 6 days, they're not getting themselves tested. So the idea is that anybody who is getting fever, on the even a fever or any kind of symptoms as far as COVID is concerned, people needs to get tested. So that is what the idea. It is about creating awareness as well, that the Anganwadi workers and the ASHA workers can play an important role. That how can they, they can ensure the health officials in these villages, the rural India can ensure that people, the testing should be done, proper surveillance should be done, that wherever the cases are coming in, the proper testing should be done, and proper containment zones should be created. So that was the focus of Prime Minister Narendra Modi as far as testing and surveillance is concerned.
Yes, and you spoke about the Asha Anganwadi. That's also Prime Minister pointed out that they play a significant role in terms of combating COVID at rural level. In fact, Arun, Prime Minister has also reportedly asked for the guidelines to be made in easy languages so that, you know, the outreach is maximized. Illustrations for home isolation, treatment in rural areas, etc. So the major chunk of today's meeting focused on policy measures, tools, strengthening apparatus at the grassroots level in rural India. Arun.
Absolutely. So the state governments are ensuring that awareness can be created as far as, the COVID-19 virus is concerned. As I mentioned earlier, that as of now in villages, rural India, people are still thinking of the fact that this is normal viral or fever and it will automatically go away. It can be because of season change. This is happening. But that's not the case. That's not the fact. And this was noted in this high-level meeting, and Prime Minister Narendra Modi clearly highlighted this fact that awareness should be created. The ASHA workers and Anganwadi workers have an important role to play as far as this strategy is concerned of creating awareness. The awareness should be created in the local languages as well. That means the state-specific language that is used, that should be used to create awareness, either by pamphlets, either by door-to-door, surveillance method. The district officials, the village officials, the Gram Pradhans, they have an important role to play over here as to how can they ensure that people who are suffering from a fever or people who are showing some symptoms of COVID-19, they actually get tested. That's number one. Testing is the need of the hour, because testing is, in the rural village level, people are not coming forward for testing purposes. So how can these key stakeholders like ASHA worker, Anganwadi worker, the Gram Pradhans primarily, or the officials, the district officials, they can play an important role, as far as creating awareness, as far as door-to-door surveillance is concerned, as far as asking that is anyone over there who is having some symptoms of COVID. So creating awareness, testing and surveillance. These are the key points, in order to win this fight against COVID-19 in rural India, because Prime Minister Narendra Modi has noted this fact that yes, this disease, the COVID-19, if in case is spreading rapidly in rural India, that is not a good, as far as our active cases are concerned. So we need to bring this positive rate primarily. The active case, primarily should decline gradually. The fatality rate should decline gradually, and the number of new cases that is coming, that should decline gradually. So that is what the idea is, and this can only happen if in case we can, the people, the officials in rural India take concrete steps to avoid or to stop COVID-19.
Arun, you tracked it very closely. That point on the underutilization of ventilators reportedly, very, very significant point raised by the Prime Minister in that meeting, that immediate audit of the installation and operation of ventilators is also need of the hour. Basically, Prime Minister monitoring the situation at the very, very micromanagement level.
And micromanagement, is the only key at this point in time, because we have seen in last 1 week or 2 weeks, there are some states, there were media reports, that were coming in, that the ventilators were unused. The dust was there on the ventilators. Various states have reported that. On one side, there were states who were asking for oxygen supplies, for oxygen cylinder, for ventilators. So on the other side, there were states who have reported that there were the ventilators were lying unused, but that were not made available to the people at that point in time. So Prime Minister Narendra Modi, has taken a serious note of this incident, and has asked that a central level audit has to be done as far as these unused ventilators report is coming in from various states, and how can these ventilators can be mobilized to the places where it is required. There a proper audit needs to be done, because there has to be checks and balances as far as the healthcare infrastructure in our country is concerned. We know this fact that on one side domestic production be it the oxygen supplies, be it the oxygen-related infrastructure that is being increased. So on the other side, health is coming in, the global health is coming in, from various countries as far as the healthcare infrastructure, the oxygen-related infrastructure is concerned. So how to mobilize wherever the case fatality ratio or primarily the caseload is coming down primarily over there, if in case some healthcare infrastructure is unused, how can that be mobilized to another state or another district primarily? And if in case there is much more need, how can more healthcare infrastructure can be provided to some state or that district primarily, so that there is no deficit as far as healthcare infrastructure or oxygen-related infrastructure is concerned, and that primarily needs to be fulfilled. And on that context, it is very much important for an audit and central level audit, that will be done as far as the states are concerned, which have reported primarily the unused ventilators or infrastructure.
Arun, stay with us. For the viewers who have just tuned in to DD News, Prime Minister Modi, Honorable Prime Minister, chaired a high-level meeting on COVID vaccination-related situation and overall situation prevailing. It was a high-level meeting which concluded a while back. Arun continues to be with us as we stay with these visuals. So basically, just to quickly do a recap, Arun, before we wrap up, ramping up of testing facilities and augmentation of healthcare infrastructure at rural level and ventilator audit, couple of important points that were discussed in this meeting.
Absolutely. Just to recap this important high-level meeting that was chaired by Prime Minister Narendra Modi, number one aspect, we know this fact that there were two important subsets of this meeting. Number one, the COVID-related issues, the healthcare infrastructure-related issues, and second was the vaccine-related or vaccination-related situation. Second important highlight, it was noted in the meeting that now testing has gone up from around 50 lakh tests per week in March to around 1.3 crore tests per week now. That means testing is being increased exponentially, and that's the reason more and more testing is being done, surveillance is being done, and that's the reason why number of active cases are now gradually coming down. The third big point is that localized containment strategies are the need of the hour. That's what was highlighted by Prime Minister Narendra Modi, and he's being highlighting this point right from the beginning, that there has to be, a localized containment strategy. That means wherever the caseload is increasing, that area should be, the containment area should be declared, and of course that should be contained at that point in time only. So this is the important strategy, not only in the urban areas, but also in the rural areas. Important aspect, Prime Minister Narendra Modi clearly highlighted this point that there should be PM has actually asked for augmentation of healthcare resources in rural areas to focus on door-to-door testing and surveillance. As I mentioned earlier, Sakal, that there are people in rural India, in villages, that people are not coming out for testing. They are still thinking this fact that these symptoms like coughing, fever is normal viral fever. It is normal, just a weather change effect. But they should understand this fact that if in case there is a pandemic in the country, that means primarily that this has to be COVID and testing has to be done. So in that context, PM has asked for door-to-door primary testing and surveillance part. Prime Minister Narendra Modi also highlighted this point that empowerment of ASHA and Anganwadi workers should be done, so that it gives a major push to fight against COVID-19 in rural areas as well. And last but not the least important aspect is that proper distribution of oxygen supply should be ensured. So these are some of the big takeaways, that was highlighted by Prime Minister Narendra Modi, and in this meeting that was chaired by Prime Minister Narendra Modi.
Also, Arun, stay with us. Reportedly, the officials gave a very comprehensive presentation on the state and district level situation of COVID. The testing part of it, the oxygen availability, very, very important area, healthcare infrastructure, vaccination roadmap. So all these aspects were comprehensively covered in this meeting chaired by Honorable Prime Minister. And in fact, this is in series, in continuation of similar meetings that have been consistently chaired by Prime Minister himself. Arun?
Absolutely. We have seen it how in a series of meetings, Prime Minister Narendra Modi, has ensured that how can COVID, primarily the oxygen-related infrastructure, the healthcare infrastructure can be strengthened. How are the three forces of our country are working? He also reviewed that aspect. Prime Minister Narendra Modi has, chaired meeting with various empowered group of officials, and of course, this high-level meeting also is in a continuation of that aspect only. This meeting primarily was focusing upon the rural India aspect. We know this fact that in big cities, in tier 1 towns primarily, the cases are gradually coming down. Be it Delhi, be it Mumbai, and be it other cities in Uttar Pradesh as well. Gradually, in the big cities, in tier 1 cities, the cases are coming down. But now the cause of the concern is the rural India. The cases are gradually, primarily increasing in the rural India, and the need of the hour is awareness in the rural India. Because I'm mentioning this point again because I had a word with various people living in the villages as of now over the phone, and they are saying that in the rural area, people are not getting themselves tested. They are taking COVID-19 symptoms as if it's a weather change symptom, or maybe it's just a normal viral fever. And that's the reason why Prime Minister is emphasizing on the fact that more and more door-to-door testing and surveillance needs to be done. And in that context, the Asha worker, the Anganwadi worker needs to be empowered, and the district level officials, the Gram Pradhans, they have to play an important role so that door-to-door testing can be done. Antigen tests primarily are being increased in rural India so that you get the result immediately as far as the tests are concerned, and you can isolate the zones in the rural India, because if in case the disease, the COVID-19 spreads up in rural India, it will be very much difficult for our healthcare infrastructure as well. And that's the reason today's meeting was primarily focusing upon the rural India aspect, the rural India, and on the other side, it was also focusing upon the vaccination drive. A detailed presentation was given to Prime Minister Narendra Modi as to how states are in contact with various vaccine manufacturers, so that ramping up of the supplies can be done. And so on the other side, 45 plus age group, what is the status all across the country as far as vaccination is concerned? That detailed presentation was also given to Prime Minister Narendra Modi. Sakal?
Yes, Arun continues to stay with us. Prime Minister, in fact, has also encouraged states to be, Arun, very transparent in terms of reporting their numbers, even if these numbers are high. And, that is an important aspect. Prime Minister stating that the states should be encouraged to report their numbers transparently without any pressure of high numbers showing adversely on their efforts. And also Prime Minister asking for the augmentation of healthcare resources in rural areas. That's what you talked about. You covered the rural area pretty comprehensively. Arun, a bit on this point on numbers, testing numbers and overall COVID numbers reported by states should be highly transparent.
Absolutely. And, this is not for the first time that Prime Minister Narendra Modi has highlighted this point, that don't be afraid of the numbers. If positivity rate is going up, the testing results are resulting into more COVID cases, the state should not be afraid of that. Testing should be increased because more and more positive cases are coming out. This gives the chance to the authorities, to contain those people and to spread the disease. Until people are tested or detected with COVID-19, the containment can't be stopped. And this is specifically happening in the rural India, in rural areas, be it the rural areas of Maharashtra, of Uttar Pradesh, Tamil Nadu, down south. You look at entire country. In rural India, in tier 3 town, tier 2 town, in villages primarily this is happening. The testing is not taking place as effectively as it should take because number one, on one side, people are not coming forward for testing. They are not getting themselves tested. And number one, the reason for that is awareness. And that's the reason why Prime Minister Narendra Modi has highlighted this point and, asked the state authorities, the district officials primarily, to ensure awareness can be created at the district level, at the village level as well, so that people do come forward as far as testing is concerned, and they come forward for testing in large numbers. That is the basic idea. Second, how can healthcare infrastructure be ensured, be provided seamlessly in the rural areas? Because we know this fact that on one side we are witnessing this point that in big cities, big towns primarily, the number of cases are coming down. That's the good news. But on the other side, the flip side of the coin is that number of cases in rural areas, villages are gradually increasing. So that's not a good sign. That's the reason the Prime Minister Narendra Modi has highlighted this fact that now the focus should be on the rural areas. And of course, the idea is how can testing and surveillance can be increased.
Right.
The big role is of the Gram Pradhans, the district officials, and on the other side, how can awareness be created as far as this rural India is concerned.
जी, अरुण आप हमारे साथ बने रहिए.